Hi, I'm Felicia. I'm with the Education Task Force, and today we're going to be talking to you about consent.
And I'm Christopher. I'm also part of the Education Task Force. And we want to make sure that everyone has the information necessary to fill out consent forms because it's a very important part of procedures here in the ICU to make sure that we have the correct permissions necessary. So first I want to go over the general consent. This is an example of a blank consent. It could be for any kind of procedure, including paracentesis, central line insertion, dialysis line insertion, arterial line insertion. So any invasive procedure that has any risk to the patient should have a consent form. This can include blood products. Now note that blood products have its own consent form, but the general principle of the rules applies to blood as well. So what on the first page here, it's going to say, I voluntarily request doctors. Now, this line here, you're going to put the actual attending physician. So here in the teaching hospital, we use primarily residents. However, we're going to here write the name of the attending physician and associate. So for example, if it's Dr. Nugent, who is the attending physician that night, we're going to write here Drs. Nugent and associates. And for this particular form, you would continue to fill out the rest that's applicable, for example, the site of the insertion of the central line. Now going back to the second page here, this line here at the very top is going to be for the physician who is informing either the patient or the patient's representative of the procedure and the risks and benefits. Now note, it's not the nurse's job to explain the risks and benefits of the procedure. It's simply our job to ensure that consent was obtained and that the paperwork is filled out correctly. So as I mentioned before, the resident is going to actually document explaining the risks and benefits on this line here. And so there are three ways that we can obtain consent. The first way is for the doctor to explain the procedure to the patient or the patient's representative while they're present here in the hospital. And that requires one doctor's signature, which is the resident or whoever's explaining it, and a witness, which would, generally speaking, is the bedside nurse. And this ensures that, that the family or the patient didn't have any questions. The second method is the telephone method, and that's going to be for calling the patient's representative or family member via telephone. And this technique's a little different. It requires one additional witness. So the doctor is going to speak to the family member and explain the risks and benefits, and two different nurses will act as witnesses, and they simply get on the telephone, confirm who they're speaking with. They confirm that they know what the procedure is and what the risks and benefits are, and each nurse is going to sign under the witness signature line and also print their name under printed as well. The third method for obtaining consent is an emergent consent, and that has to be done by two attending physicians that are not involved with the patient's care. So for example, at night, when the attending physicians generally are not here, we can call the ER, and one of the physicians down there will act as a witness, and we can actually tube this down to them and they will sign it, and then the second signature will come from the attending physician, intensivist in the morning. So those are the three different methods. So we can either do it directly with the patient or the family member who's present in the hospital. That requires one doctor and one nurse signature. The telephone consent is going to be one doctor signature and two nurse signatures acting as witnesses. And then the emergent consent is going to be the resident and then two attending physicians who are not involved with the patient's care. And then Felicia is going to explain some of the paperwork that goes along after getting consent to ensure that we have all the supplies and the steps we need to make sure that the procedure is done safely.
Okay, so now that you've obtained consent, you are going to go to the intranet or ask the hub to and get the bedside procedure paperwork for you. The only thing that's different is with the blood consent, you do not need this. This here I have an example just of simple for checklist for central lines. So the first page is, it basically goes through and I just want to make sure you have procedure consent, sedation consent if they are requiring sedation the sedation record, bedside procedure, bedside universal protocol form, excuse me, the moderate sedation audit form, and central line checklist. And that part can be filled out by the HUC or the nurse. Usually the nurse is the one filling it out at the bedside. And also there's a section here just verifying privileges, making sure you have all your supplies in the room, and more importantly that you are charging for the procedure on the charge sheet. The second page of this form is the moderate sedation audit tool. The first couple questions will ask if your patient is getting sedation or not. And then the second question is if they're not getting sedation, you select no or circle no, and then you stop filling that out. Sign, date, time, and turn that in. The one thing that is pretty much universal across the board with all any procedure is the universal protocol checklist. This is basically a timeout for the procedure, verifying that you have the right patient, you have you're doing the right procedure, you have the consent for said procedure, and if applicable, you are verifying your site. So you'll go through and you'll check your identifiers off. Then also here you will you'll write the physician involved, nurse, if there's anesthesia or any other care provider, and then here you will put if it's just you filling out sections 1 and 2 of the sheet, then you will sign, print your name, sign, date, and time. Or if there's someone else that's filling out both sections, then you will take care of that as well. Some procedures only require just the first 3 pages. The central line has an additional checklist for us, and you'll go through with that and just kind of verify. Just kind of ask you questions, and you'll do yes, reminded, not observed, or no. And then for the bottom, it says verification of your central line, and it says it is for emergent catheter placement. So you just want to make sure that there's just like double. A lot of times the forms or the lines are put in emergently, sometimes not with ultrasound guidance, or it's kind of a little tricky. You're not really sure where it's going. You just want to have a verification method to make sure that you're not, say for example, if using like a vasopressor in the artery, we wouldn't want that to happen. So you're going to make sure you are checking this off if necessary. Fill out the bottom part, and this piece of paper will go into Christy's box. And go back to this. This goes into the HIM basket on the unit to be scanned in, and then these 2 forms will go into Christy's box as well. If you have any questions, just ask your charge nurse or the HUC, and they'll be glad to help you out. Thank you.
So that's a brief overview of obtaining consent, and just as a final note, again, it's not the nurse's job to explain the risks and benefits of the procedure. It is entirely the physician's responsibility. It's simply our job to make sure that all the paperwork is filled out and documented, and that if the patient has any questions, that they're answered, and that the patient understands the risks and benefits. So we hope this is helpful. Thank you.